I want to talk about what I do to make it possible to walk with no canes or walking sticks. I haven't nailed this down, but I'll give my best description, at least how I see it. Now, when I start walking, I generally have two things in mind. I like to look forward, pick a target, and stay on that target. And I also like to think to grip the ground with my feet. Now, I find it very difficult to actually get traction and be able to grip the ground with my feet because they're just not strong enough and they don't respond quickly enough to the surface conditions to get proper grip. So, to tell myself to grip the ground just gives me a little extra focus. Now, the other things I do, I don't consciously think of. They just subconsciously happen. And one of those things is I take shorter strides than I normally would using walking sticks. When I walk without walking sticks, I shorten my stride because it makes it easier to balance. If you have a problem, you can more easily correct it by using a shorter stride. Another thing I subconsciously do is I tighten up my upper body. I tighten up my chest and my arms. And I found that doing this also helps me balance. If I have a mistake or I just feel unsteady, then my arms will subconsciously act in a way that tries to maintain my balance. Now, I don't necessarily know how I would tell somebody to train their subconscious to do these things. I think it just comes down to muscle memory and taking the risk over and over and over again until you gain the ability for your body to just understand what it should be doing. I wish it wasn't this way. I wish there was a more concrete explanation, a step-by-step process of how to achieve this goal. But life is complex, and sometimes there is no easy fix. Sometimes you just have to take the risk, and sometimes it pays off. In my case, at least as a party trick, it's paid off. I don't think I'll ever be able to walk unsupported in a truly safe manner, but for my purposes of just trying to do it, I would call it successful. And that just came from days and days and days and months and months and months of just taking risk. I think part of the reason why doctors struggle so much with brain damaged patients is because they really don't have a way, an adequate way, of training the brain yet. A lot of it just comes down to the patient and what that patient ultimately ends up being able to do. I think doctors can only help so much. That's also why I think physical therapy for cerebral palsy fails, because, like doctors, physical therapists can also only do so much. I think whether you become more successful in your abilities with cerebral palsy really comes down to a few things. It comes down to luck, in that you keep trying, you don't get hurt. It comes down to pain tolerance, how much pain you're willing to go through to maybe achieve a better outcome. And it also comes down to athletic ability. If you're athletic or your family's athletic, you're going to have an easier time achieving that subconscious state of having your body being able to be in a position where it can learn to walk. On the other hand, if you're not athletic, you're probably going to have a lot of trouble with this, and it's going to make things almost impossible. Those are just my thoughts.